Hi guys, I'm Dr. Keogh and I want to take just a few minutes to talk to you about a very simple maneuver that can be very helpful for babies that are dealing with digestive distress and colic and reflux and stuff like that. In our practice, we've used this maneuver for many years and we've shown a lot of parents how to do it. It's simple, it's safe, and very effective. Earlier in this year, there was a research article that came out that talked about the harmful long-term effects for taking acid-blocking medications, basically when babies are on acid-blocking medications, and how that can impact them up to the age of 5, and how that leaves them more prone to things like fractures. So we in this office try to do everything we can to help our babies not struggle with these these very common digestive issues. And so often, parents don't have any other answers, so they resort to these acid-blocking medications like Prilosec and Zantac and whatnot. And no parent wants to harm their child, of course, but at the same time, parents also don't want their child to be in extreme distress and crying and fussing all night. So we can understand why a lot of parents reach for those options because they don't know where else to turn. So this is a really simple, safe maneuver that can be done by anyone right now. So I've got a sleeping baby in my arms, so I'm going to try to not wake him. But basically, the first step is you want to hold him in a modified football hold. So what that looks like is, sorry buddy, like this. Okay, so this is a nice just in and of itself for babies that are dealing with colic and reflux, because when they're at an incline, it naturally helps to relieve the stress on the stomach and the esophagus. So a lot of babies will like that just in and of itself. The second part is to add in a very gentle pull down or tummy tug. So what you do is you use your other hand and you go through the legs and you find their ribs. You find the edge of his rib here on the left, his left side, and you just gently tug down, very, very gently, not a lot of pressure at all. It's more of a pull. So you're gonna do that 5 to 10 times. Just continue doing that. And sometimes, bouncing and dancing is also really helpful. But this right here will help the stomach, which a lot of times in little ones will ride up under the ribs, and those acid producing cells that are inside the stomach can start to form up into the esophagus, which can be really uncomfortable for these little babies. So just doing this over and over, 5 to 10 times, as many times as you need to do it, this can be really helpful for these common digestive complaints like colic and reflux. So that's the maneuver. That's it. Also, we have to discuss some other major players when it comes to colic and reflux for babies, and a really big one is what's mom's eating. So if baby is continuing to have intense symptoms, you have to look at what mom's eating. So is she eating too much dairy? Is she eating different spices? Is she eating things that is causing the baby to have a reaction? So having somebody help mom look through that is really important. We do a lot of that in our office, as well as identifying if the baby has a tongue tie or lip tie, because when the baby has a tie, it can create an abnormal latch, and then the baby starts to swallow air, and that can create a lot of gas and digestive distress as well. And then of course, if mom has a oversupply or an undersupply. So those are all factors that can really cause digestive issues in little ones. So that's stuff that we do in our office. So if you know a mom that's struggling with this, has a baby that's struggling with this, and they're up all night, every night, not getting sleep, please forward this video to her so she can watch that. And then tell her about our office. This is what we do in our office. Now he's awake. We work with babies and moms to get them started off on the right foot so they do have the best breastfeeding relationship. We have chiropractic care, massage, we have nutrition, and we have lactation counseling in our office. So all very helpful for new moms and babies. So hopefully this video is informative and you enjoyed it. Please share with any moms that you think would benefit from that. And I hope you guys have a fabulous day. Thank you.